Hello everyone. Today our topic of discussion is the terminologies related to anatomy. These terminologies will help us to learn anatomy. First is anterior. Anterior means towards the front or in front. Next, posterior, towards the back or behind. Next, medial, closer to the midline. Lateral, farther away from the midline. Next is superior, which means above or on top of. Next, inferior, below or underneath. Next, proximal, nearer to the trunk. Distal, farther from the trunk. Superficial, closer to the surface. Deep, farther from the surface. Medial, a plane close to the median plane or midline. Lateral, plane away from the median plane. Ventral or anterior, front of trunk. Next, dorsal or posterior, that is back of trunk. Then the positions of body. Supine position. Person lies straight on the back with face directed upwards is known as supine position or recumbent position. Next position is prone position. Person lies straight on the abdomen and face directed downwards. Next is lithotomy position. Person lies supine with hips and knees semi-flexed and thighs abducted and feet strapped in position. Terminologies of movement. First is flexion. Flexion refers to a movement that decreases the angle between two body parts. Next is extension. Extension refers to a movement that increases the angle between two body parts. Next is abduction. It is a movement away from the midline. For example, abduction of the shoulder raises the arms out of the side of the body. Next is adduction. Adduction is a movement towards the midline. An adduction of the hip squeezes the legs together. Next is medial rotation. Medial rotation is a rotational movement towards the midline. It is sometimes referred to as internal rotation. Next is lateral rotation. It is a rotating movement away from the midline. Next is elevation. Elevation refers to movement in a superior direction. Example, shoulder shrug. And depression refers to movement in an inferior direction. Next is pronation. Pronation is the medial rotation of forearm so that the palm comes to face backward. And supination. Supination is the lateral rotation of forearm so that the palm comes to face anteriorly. Next is dorsiflexion. Dorsiflexion refers to flexion at the ankle so that the foot points more superiorly. Plantar flexion. Plantar flexion refers extension at the ankle so that the foot points inferiorly. Next is inversion. Inversion involves the movement of the sole towards the medial plane so that the sole faces in a medial direction. Next is eversion. Eversion involves the movement of the sole away from the medial plane so that the sole faces in a lateral direction. Next is circumduction. Circumduction can be defined as a conical movement of a limb extending from the joint at which the movement is controlled. Just example as in bowling. Next is opposition. Opposition brings the thumb and any other finger together. Next is reposition. Reposition is a movement that moves the thumb and any other finger away from each other. Effectively, it is reversing opposition. These are the references. Thank you for listening.